independent double checks and line reconciliation.
Hi, I'm Julie Murphy, a nurse and a senior clinical quality improvement specialist at Boston Children's Hospital. Today, we'll be talking about the independent double check. The learning objectives of this video are to identify some high alert medications that could require an independent double check, describe how confirmation bias can negatively impact an independent double check, and describe the steps of an independent double check for intermittent and continuous medications.
Medication errors and high alert medications.
Medication errors are preventable patient safety events. During the medication administration process, double-checking high alert medications provides an additional level of safety. High alert medications are drugs that can cause significant patient harm when administered incorrectly. The independent double check is the process of verifying another practitioner's work by independently performing calculations, visualizing the medication, and verifying pump settings, lines, and clamps without interference or bias. The Institute for Safe Medication Practices, or ISMP, explains, two people working independently are less likely to make the same mistake. If they work together or suggest what the checker should find, both could follow the same path to error. Organizations determine their own high alert medication lists based on recommendations from the ISMP and institution-based medication error data. The screen shows ISMP's 2024 high alert medication list. Likewise, based on an organization's policy, clinicians, such as physicians or pharmacists, can administer medications and participate as the second clinician in an independent double check. This video focuses on nurse administration with a nurse double check. The medication to be administered determines whether an independent double check is required. When administering a high alert medication that requires an independent double check, two nurses complete independent double checks before administration.
Confirmation bias.
People tend to seek information that confirms what they believe. If one nurse tells another their dose calculation, the second nurse is more likely to agree with the dose than if they completed the check on their own. This must be avoided. Instead, the independent double check must be done alone and apart. Performing the double check alone and apart prevents confirmation bias. A confirmation bias occurs when the first nurse's judgment or calculations influences the second nurse's judgment or calculations. A checklist may be used to guide nurses when completing the independent double check. Nurse 1 reviews the order, performs calculations, prepares the medication, and confirms the 5 rights. To confirm the 5 rights of medication administration, make sure you have the right patient, drug, dose, route, and time. Nurse 1 then asks Nurse 2 to complete the same process on their own. Nurse 2 visualizes the prepared medication and confirms if it is correct. If the medication is correct, Nurse 1 scans the patient's identification band and medication and administers the medication. If the medication is being administered intravenously by a pump, follow steps 1 through 5 above, and then complete these additional steps of line reconciliation prior to administering the medication. Nurse 1 programs the pump, confirms the settings, connects the tubing, and completes line reconciliation. Nurse 2 checks the settings and completes line reconciliation on their own, with no conversation or confirmation from Nurse 1 during the process. The separate checks are key. After Nurse 2 states that no errors were found in the process, Nurse 1 administers the medication.
Demonstration. Independent double check with intermittent medication.
Prior to preparing the drug and completing the independent double check, the nurse consults the hospital medication formulary to verify the dose is correct for the patient's age and weight, checks for compatibility and contraindications with other medications the patient is receiving, and confirms the child is not allergic to the medication. Nurse 1 reviews the order by accessing the patient's electronic medical record to confirm the 5 rights of medication administration. The order is for 1.2 milligrams of morphine for a patient named Salwa drug to be administered intravenously every 4 hours as needed. The morphine is available as a vial of 2 milligrams per milliliter. Nurse 1 matches the information in the medical record to the patient. He checks the wristband to make sure he has the right patient and checks the patient's lines since the right route is intravenous. He visualizes the drug to ensure he has the right medication and performs the dosage calculation to ensure the right dose. 0.6 milliliters of morphine should be drawn up in a syringe and administered to the patient. After confirming the 5 rights, Nurse 1 asks Nurse 2 to complete an independent double check.
Hi, Jennifer. Could you please double check my morphine dose, please?
Oh, yeah, sure. Just give me a minute.
Thank you.
Hi, Will.
Hey.
What am I
thank you.
checking?
Yeah, I'm doing morphine 1.2 milligrams. Mark it up.
Okay.
Nurse 2 reviews the patient's medical record to confirm the 5 rights of medication administration on her own. She checks the wristband to make sure she has the right patient. She completes the dosage calculation. Nurse 1 examines the dose, then the syringe. She verbally states the dose is correct.
Yep, 0.6 mLs is correct, 1.2 milligrams for Salwa drug.
After Nurse 2 completes her independent double check, Nurse 1 scans the patient's identification band and medication.
I'm going to do it on their PIV line.
Persons administering medications should consider wearing gloves based on individual hospital policy. Please be sure to check with your hospital's policy regarding wearing gloves for medication administration. Before medication administration, Nurse 1 flushes the line with normal saline or another compatible flush to ensure patency. He administers the medication, then flushes the line again with normal saline after administration to ensure the dose is administered and the line remains patent.
Demonstration: independent double check with continuous medication.
For the purposes of this demonstration, the side rails of the patient's crib will be lowered. However, it's important to note that in a real hospital setting, side rails should always be raised to ensure patient safety. Nurse 1 reviews the order by accessing the patient's electronic medical record to confirm the 5 rights of medication administration. The order is for 7.4 grams of fish oil emulsion for a patient named John medication to be administered intravenously with a hang time of 12 hours and an administration period of 24 hours. Nurse 1 matches the information in the medical record to the pre-prepared syringe of fish oil emulsion. Then she checks the patient's wristband to make sure she has the right patient. After confirming the 5 rights, Nurse 1 asks Nurse 2 to complete an independent double check.
Oh, hey, Will, can you do an independent double check for me?
Absolutely.
Great, thanks.
Hi, Jennifer.
Oh, hey, Will, I just need an independent double check and line reconciliation for fish oil emulsion. I need to hang a new syringe.
Okay, thank you.
Nurse 2 reviews the patient's medical record to confirm the 5 rights of medication administration on his own. Nurse 2 visualizes the syringe and compares the patient information on the syringe to the patient's medical record. Then he checks the patient's wristband to make sure he has the right patient.
That's the correct medication.
Great.
After Nurse 2 confirms the 5 rights of medication administration, Nurse 1 scans the patient's identification badge and medication. She programs the pump settings and connects the tubing. Then, she completes line reconciliation by tracing the line from the syringe to the patient.
Great. Can you check my rate and do a line reconciliation?
Yes.
Nurse 2 reviews the order. Pump settings. And completes line reconciliation.
I can confirm that the pump rate's correct and the lines are connected correctly.
Great, thanks. I'll start it.
Nurse 1 administers the medication.
Conclusion.
When completed correctly, independent double checks can prevent up to 95% of medication errors. For high alert medications, performing the independent double check provides an additional layer of safety for patients receiving these high alert medications and the nurses administering them.